Dear friends, in this video you will get detailed information about diverticulitis. Diverticulitis occurs when small pouches in the wall of the large intestine become inflamed or infected. It is more common in older adults. Simply having these pouches is called diverticulosis and many people never experience any symptoms. If symptoms occur, they can range from mild discomfort to a serious infection that requires emergency treatment. Now we will discuss diverticulitis symptoms. The symptoms of diverticulitis are as follows. 1. Abdominal pain. The most common symptom of diverticulitis is abdominal pain, usually on the lower left side of the abdomen. The pain often starts suddenly, but it can also gradually worsen over several days. It may become constant and tender to the touch. 2. Fever. Another common sign of diverticulitis is fever. It is often accompanied by chills and may indicate that an infection is developing. 3. Changes in bowel habit. Many people also notice changes in bowel habits. You may experience constipation, diarrhea, or sometimes both during the course of the illness. 4. Nausea and vomiting. Nausea and vomiting can occur especially if the inflammation becomes more severe. 5. Loss of appetite. Some people lose their appetite and feel unusually tired or weak because the body is fighting an infection. 6. Common gastrointestinal symptoms. Abdominal bloating, gas and tenderness are also common complaints in patients. Warning signs of diverticulitis. Most cases of diverticulitis get better with treatment, but some warning signs should never be ignored. These are as follows. Severe or worsening abdominal pain, a high fever that doesn't improve, persistent vomiting that prevents you from keeping fluids down, blood in your stool, a swollen rigid abdomen, dizziness, fainting or signs of dehydration. These symptoms could indicate complications such as abscess, bowel perforation or a blockage, all of which require urgent medical treatment. Who is at a risk? The risk of diverticulitis increases with age, especially after age 50. Several factors can increase your risk of developing diverticulitis. These are as follows. A diet low in fiber, obesity, smoking, lack of regular physical activity, and certain medications such as long-term use of NSAIDs may also increase the risk. Diverticulitis diagnosis. Early diagnosis and treatment of diverticulitis can help prevent serious complications. Your healthcare provider may recommend blood examinations, imaging such as CT scan, and appropriate treatment based on the severity of your symptoms. Now we will discuss the most important part, treatment of diverticulitis. The treatment of diverticulitis depends on the severity of the condition. Mild cases of diverticulitis may improve with rest, temporary dietary changes, and sometimes antibiotics depending on the situation and your healthcare provider's recommendation. Besides, most severe cases may require a hospital stay, intravenous fluids, antibiotics, or in rare cases, surgery. Diverticulitis prevention. You can't always prevent diverticulitis, but a healthy lifestyle may help reduce your risk. Aim for a fiber-rich diet that includes fruits, vegetables, whole grains, and legumes. If you are increasing your fiber intake, do so gradually and drink enough fluids to help your digestive system adjust. Besides, drink plenty of water throughout the day. Stay physically active. Maintain a healthy weight. Avoid smoking if possible. If you experience persistent lower abdominal pain, fever, or changes in your bowel habits, don't ignore these warning signs. Prompt medical evaluation can help prevent complications and lead to faster recovery. This was all about diverticulitis. If you found this video helpful, please give it a thumbs up, subscribe for more easy to understand health information, and share it with someone who might benefit from it. Thanks for watching and we'll see you in the next video.